Hi. During surgery, when a particular strategy doesn't work, which we had initially thought would work, we should be smart enough to immediately assess the situation and then use an alternative strategy. And this has to be done quickly so that we don't end up having an intraoperative complication. Let me take you through one such case. She is an 80-year-old elderly lady who is posted for cataract surgery. She has got a dense cataract. It's about grade 4, grade 5 brown cataract, and she is scheduled for a toric intraocular lens. The pupil is very well dilating, so I don't find any major issue. The incisions are made, the capsule is stained, and the time to do the rhexis. Now, since this is an eye which is scheduled for toric intraocular lens, usually my rhexis size would be around 4.5 to 5 millimeter in these eyes to ensure that the lens is well centered and the rotation is minimized. But in this case, the rhexis turned out to be smaller for the density of the nucleus. The nucleus is very dense, and it could be a challenge for me to crack the nucleus with this size of a rhexis. This rhexis size would be okay for a softer cataract, but I think I'm going to struggle with this size of a rhexis. Let's see how things turn out. The nucleus division strategy is going to be usual, that is, just create a small central trench and then try to do a vertical chop. So I'm using sculpt mode with a high torsional energy to create a small central trench that is being done quite easily. Once I've reached about 70% depth, now is the time to divide the nucleus. So settings are changed to the chop mode, where I'll be using only the burst longitudinal energy, and I'm trying to bury the phaco-tip into the substance of the nucleus and then do the vertical chopping. But the chop is not successful. The full thickness separation is not happening for two reasons. One, I'm not able to get a good hold, and second is the posterior plate happens to be very, very thick. So I'm rotating the nucleus and trying to choose another area. The same principles of burying the tip into the nucleus. And the burying is quite good. The hold also is quite good now. And the chopper goes down vertically, and then I'm trying to separate laterally. At this moment, I realize that the posterior plate is extremely thick and resistant to cracking. So now a situation where I think I have stuck. I'm now thinking what to do. Now, should I continue to chop or should I change my strategy? So in this case, I decided to change my strategy to the 4-quadrant technique, where I'm going to sculpt deeper and divide it into 4 quadrants and then emulsify. The idea is, because the posterior plate is so thick, once I have a very deep groove, and then I'll be requiring lesser manual energy to break the posterior plate. Otherwise, with this smaller rhexis, if I try to stretch, there is always a risk of the rhexis giving way. So that was my concern when I decided to switch to a 4-quadrant technique. So as the machine has torsional energy, which is extremely friendly for the wound, we don't get wound burns with this torsional energy, I thought I'll go ahead with a 4-quadrant technique. The classical 4-quadrant technique is an extremely effective, efficient way of breaking these hard nucleus, especially when we have an torsional phaco energy, because it can cut the nucleus very effectively without causing any wound burns. So I begin my sculpting. The settings are again changed. I'm going to use just continuous torsional with very low flow rate and vacuum. The idea is to get a very deep and long grooves. So I want to create this cross sign, which is the grooves are extremely deep and long. If we have these deep and long grooves, then we require lesser physical energy to crack them into 4 quadrants. So that was the idea. And when I started deepening this groove and lengthening this groove, I realized that the size of the rhexis can be a hindrance, and during this sculpting itself, there could still be a possibility that the rhexis could be compromised. So I quickly realized that I need to have a bigger rhexis. So I come out of the eye, put in dispersive OVD again, and using the scissors, a tangential cut is given to the rhexis margin, and the capsule rhexis is then being enlarged. Well, it's going to take a couple of more attempts to get the rhexis enlarged on either side. eventually we have a rhexis which is quite large, and this sized rhexis should not be at risk of getting compromised during nucleus manipulation. Of course, it's quite big when we are thinking that we want to fixate a toric lens, but I think safety is our first priority, so I would want to err on the side of a bigger rhexis. The process of lengthening and deepening the grooves is continued. The lens is rotated and the sculpting is continued. I'm increasing the speed of the video so that we can save some time. I have made a couple of videos on the 4-quadrant technique and the stop and chop technique. The links are being provided up above. If you are interested to learn those techniques, you can just click on them and try to understand the finer nuances. Now, how do I decide on the end point of sculpting? And this is an extremely dense cataract, so I want to go as deep as possible, maybe about 90% depth or 95% depth. The moment I see these small flake which is just remaining, by sculpting so deep, what I have achieved is that the thickness of the posterior plate is significantly reduced. It's no more thick, so that when I try to divide it, it should give way much more easily. So that was the goal, and hopefully this much of thickness of the posterior plate would not cause me much of a problem. For lateral separation, I'm going to use the chop mode again. I'm going to use the longitudinal energy to bury my phaco tip. The point where I'm holding the nucleus is just above the posterior plate. To help me reach out to a plane which is much more nearer to the posterior plate, I'm using a chopper which is pretty long so that I can reach the intended posterior plane much more easily. Even with such deep sculpting, the posterior plate is refusing to give way. So imagine the tenacity of these fibers. So it's going to take multiple attempts of lateral separations to eventually separate these two fragments. The nucleus is rotated, the tip is buried into the nucleus is stabilized, and the left hand begins to work. So again, it's going to take more than a couple of attempts and progressively deeper placement of the chopper, which is going to break this leathery plate. So this leathery plate is extremely tenacious. I'm just reminded of the dialogue, never underestimate the power of these leathery fibers. So such cases are going to test our patience. The key or the secret is to be just focused on the basics. Our goal is to divide the nucleus in a very atraumatic way and just try to focus where the tip is being placed and where the chopper is being placed, rather than being too overtly bothered about its lack of cracking easily. The moment we're focused on doing the basic things right, like whether I'm stabilizing the nucleus properly and placing the chopper at the right plane, once we are conscious of these and mindful of what we're doing, usually things will work our way. So slowly but surely, the fragments are divided. The last heminucleus pops out of the bag. It needs to be chopped at the level of the rhexis margin. Time to replenish the OVD. I think we shouldn't forget that the protection of the endothelium is our primary concern. Dispersive OVD goes in first, followed by HPMC. The fragment which had come up is repositioned in the vicinity of the bag. Now time to emulsify these fragments. The settings are changed to the quadrant removal mode, where we're going to use continuous torsional energy with a high flow rate and vacuum. The fragment is being emulsified in a very controlled manner. The next fragment is again pulled out from the fornices of the capsular bag, pull it near the center of the capsular bag, and then being emulsified. Since we are dealing with an extremely dense nucleus and the fragments are going to be very hard and thick, to minimize endothelial damage, I'm coming out and injecting OVD again into the eye. So such cases are going to take a lot of time, but we need to be mentally prepared for this and give every bit of extra minute which these cases deserve. We need to remind ourselves that it's okay to be slow. There's no race to finish the case at a particular speed. And slow and steady always wins the race. Need to remember this simple thing. The nuclear fragment is nudged so that the base of the fragment comes nearer to the phaco tip and the emulsification is begun. Although these fragments are quite wide in their span, but most of the core of the nucleus is already sculpted out. So they really don't cause much of an issue during emulsification, because our sculpting is quite deep and the central hard part of the nucleus is already taken care of. Nevertheless, it's imperative that we control the lens chatter and turbulence by using a judicious amount of phaco energy, which can be controlled by the foot pedal. Now, this is a huge piece, but nothing to worry. You just go a little bit slow. I'm extremely careful in using the power. So if I use more power, it's going to emulsify a certain portion of the nucleus, but also push away the nucleus, and this big piece can roam around in the antechamber. So I'm going to be very gentle, very slow with the delivery of the power, and bit by bit this nucleus is going to be emulsified. I can see there's absolutely no chatter. The lens fragments are very stable, and in a piecemeal fashion, in very slow and controlled way, the entire large fragment is emulsified. Moving on to the last fragment. Again, it's quite wide and big fragment. The chopper is held just above the nuclear fragment, and I'm just going very slow with the phaco power here. It takes some time for the nucleus to melt or get emulsified. The beauty of using the right amount of phaco energy for that particular fragment is that the fragment does not leave the tip at all. It's always there around the tip, dancing around it, and slowly but surely it's going to get reduced in size as it gets eaten bit by bit. Enough consuming a lot of energy. We can see that the wound looks pretty healthy. There's no evidence of any wound burn. So the emulsification process, the toughest part of the case, is over, and let's have a look at the effective phaco time. And this is quite high, and let's see how things turn out the next day. The cortex aspiration is done. OVD is put into the eye and the lens is implanted into the bag. And both the haptics are in the bag. Time to remove the OVD. OVD both in front and behind the lens is aspirated out. Now before doing the final alignment, the side ports and the main incisions are hydrated, and the lens is then aligned so that the markings on the lens align with the markings on the cornea. That's it, the case is done, and let's see how things are on the first post-op day. These are the first day post-op pictures. The cornea is quite clear. Patient's vision is quite good and she's quite happy about it. So to summarize, this was a case where my initial judgment or assessment of the nucleus density was not right. So I thought the direct chop technique is going to work, which is my usual technique in most cases. And unfortunately, the posterior plate with the leathery fibers in this case were extremely thick and tenacious and resistant to cracking. So I had to change my original plan to plan B, that was to do a 4-quadrant technique. And while doing that, I realized that the rhexis is relatively small and it could be at risk of getting damaged during nucleus manipulation. So intraoperatively again, I needed to stop and take a call whether to enlarge. So decided to enlarge the rhexis margin, and eventually turned out to be a blessing, so that as I realized later that the lateral separation was still a challenge in spite of doing a deep sculpt. Having a larger rhexis definitely helped me in dealing with this dense nucleus. So the take-home message is we need to be flexible enough to change the plans or strategies depending upon the intraoperative situation. Thank you for watching, and I hope you found this helpful.